Alright, so the next thing we're going to do is a neurological assessment. So here we're going to be doing a lower quarter sensory screen, moving into deep tendon reflexes, and then it says neural tension test, straight leg raise and contralateral straight leg raise. I'll kind of breeze through that though because it was similar to the straight leg raise test that we did earlier, but it has different intents. So here we're more trying to determine whether, not whether there's reproduction of symptoms that the patient came in with, but whether there's tension on that nerve itself rather than compression caused by a disc protrusion or herniation and so forth. So the first thing I'm going to do is ideally you would ask the patients to remove their clothing because you don't want to do sensation testing through clothing. However, she has long pants on, so we're going to pretend that she has shorts. And then the next thing is I'm going to instruct the patient. So today we're doing a sensory screening. So this is just testing the sensation or the feeling that you have in your legs. So what I'm going to do is, not right now, but I'll have you close your eyes. And I'm going to basically brush this on your skin. So can I have your arm for a second? This is what it's going to feel like. Okay? Just a quick little touch. And I'm going to ask whether you feel this or not. And you just say yes or no. And so I'll just press different points on your lower legs. And then you just respond with yes or no. Any questions? Okay, so go ahead and uncross your legs for me, close your eyes, and we're going to get started. Can you feel this?
Yeah.
Can you feel this?
Yeah.
Can you feel this?
No.
I didn't touch her. Can you feel this?
Yes.
Can you feel this?
Yeah.
Can you feel this?
Yes.
Can you feel this? Can you feel this? Can you feel this?
Yes.
Can you feel this?
Nope.
Can you feel this?
Yes.
Can you feel this? Can you feel this?
Yeah.
Can you feel this? Can you feel this? Can you feel this? Can you feel this?
Yep.
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 Can you feel this? Don't touch her. Can you feel this?
Yes.
Can you feel this?
Yes.
Can you feel this? Can you feel this? Can you feel this?
Yes.
Ideally, I would also have her lay on her stomach, so you can go ahead and do that. Can you feel this? Can you feel this?
Yeah.
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 Can you feel this? 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 Okay, so basically what I'm doing is trying to get 3 to 4 points of contact within each dermatome, and essentially, or ideally, you would want to spread that out. That way, you're not following the dermatomal pattern and just keeping that in mind. So, since I already have her in the back portion, S1 is going to come laterally up the leg like this, S2 more medial, and then coming in a shape like this, and then S3, a circle, S4, and then the closest sensory portion to the anus would be S5. So, on myself, it would be L1, L2, L3, L4, down here, L1, L2, L3, L4, and then L5, and then I already showed S1, S2, and then S3 through 5 on Bree. So the next thing that we're going to do is deep tendon reflexes, so if you can go ahead and sit up for me. For a lower quarter screen, I'm just going to check 2 main ones. The patellar reflex, and then the Achilles tendon reflex. So the first one, I'm going to palpate the patella, have the patient relax. I got a little bit of a reflex, so I would say that was normal. The next one, I'm going to go ahead and just lift the foot up just a tad. Got a reflex there. So I would say both of those were 2+ since they're normal. And then the last thing that I'm going to go over is just the neural tension test. So you can go ahead and lay on your back for me first. So one thing you're trying to do here is, you can do it various ways, but you're trying to put the nerve on tension to see if there's any issues involving the nerve stretching itself. So first thing I can do is go ahead and raise the leg. Do you feel anything here? No? Okay. So one thing I can do is invert the foot a little bit and dorsiflex, and then go ahead and raise. Do you feel anything? No? Okay. A little bit? So I would back off. And then since you did feel that, I don't want to add in another component, but one more thing you could add to it is, I'll back off a little bit, do the same thing, dorsiflex. She could lift her head a little bit. That's creating more flexion and putting more tension on that nerve. So that's what I would do for straight leg raise. You can do it to the opposite as well. You could also do slump. You do the slump test. That will determine neural tension. One more, just having her supine, well, now have her go prone, is I could do the femoral nerve tension test. So here, I would just bend the knee a little bit, grab under, okay, and then I would just slowly extend the leg. So here, you're looking for the same type of symptom reproduction. You want that tingling, burning sensation, and you just want to make sure that it's not coming from a stretch in the anterior portion of the leg, because that might indicate rectus tightening, and that's a different symptom or issue compared to the neural tension testing. So that's all I have for that.